My name is Dr. Douglas Street, and I want to welcome you to the fourth in the series, Achieving Optimal Health. This evening we're going to be looking at anxiety disorder and what it is, what causes it, and what we can do about it. Now, it's normal to feel anxious now and again, especially when you're stressed. But sometimes these feelings of anxiety can be excessive and can go above the norm. But anxiety disorder is a different kettle of fish. It's not just having symptoms of anxiety, but it's actually a medical condition, just like hypertension, just like diabetes. And it's not a sign of weakness, it is a medical illness. Now, anxiety disorders are actually fairly common, and typically they affect about 20% of any given population. And they tend to affect women more than men. Some think it's because of the hormones that are in women. And they tend to coexist with other conditions as well. Conditions like, for example, diabetes, hypertension, depression. And there are actually two different types of anxiety disorders. There's a generalized anxiety disorder, and there's a panic disorder. Generalized anxiety disorder usually causes a person to be in a constant state of fear and worry, and they worry excessively over everyday things. These symptoms, for you to make a diagnosis of generalized anxiety disorder, they must be present for at least 6 months. These symptoms include things like fatigue, fidgeting, headache, nausea, numbness in the limbs, muscle pains and stiffness, fullness in the chest tightness, shortness of breath, racing of the heart, sweating, restlessness, sleeping difficulties, problems concentrating, agitation, tremors, abdominal discomfort, and even hot flashes. In panic disorder, symptoms are usually more dramatic, and the symptoms are very unpredictable and they're uncontrollable. So for may have, as mentioned before, severe symptoms of anxiety. They may also have racing of the heart, sweating, shortness of breath, fearfulness, dizziness, trembling, numbness and tingling, sensation of choking, and even fainting. And these attacks may last as long as 10 minutes, and they may even continue until medical treatment is administered. Sometimes they may be confused with symptoms of asthma, and you find sometimes a person may even be treated for asthma when this is a condition they have. And of course, sometimes both conditions may coexist. Or sometimes it may appear like a heart condition, especially because of the racing of the heart that comes with it. Now, it's very important that if you're having symptoms like these, then they must be seen by a medical practitioner, because a layperson cannot diagnose this condition, because you may have anxiety symptoms for other reasons. So you must establish that this is a diagnosis before treatment is administered. We're going to be looking at what are some of the causes of anxiety disorder and how it can be treated. The traditional teaching in terms of the cause of this condition is that it is not known, but some recent research has actually given some clues into some of the factors that can cause a person to develop this condition. It is well known that stress and genetic factors play a big role in this condition. And now what they've actually found is that the intestinal microbiome is one of the main factors that contribute to the development and persistence of anxiety disorder. The intestinal microbiome is actually that large community of bacteria that live in our intestines. And what they've found is that an imbalance in this bacteria can actually trigger the anxiety disorder. What they found is that there is a very strong connection between the intestines and the brain. They actually have kind of a term called the gut-brain axis. And what they found is that the bacteria in our intestines actually produce what we call neurotransmitters, and these are actually substances that are used in the brain to transmit information. So what happens in some people is that they can develop an imbalance of the bacteria, and what that means is that Normally, in the bacteria in the intestines, there are over 1,000 different types of bacteria, but you must have them in the right proportions. When this balance in terms of the proportions is lost, then it can affect the brain function in various ways. And this is one of the ways that it can actually affect the brain function, in that it can actually predispose the person to having anxiety disorder. As I said, this is a recent research. This is recent research that is being done now, and so it's something which has not been fully fully assessed and understood. But they have found a definite connection between the balance of the bacteria in the intestines, called the intestinal microbiome, and the existence of anxiety disorder. Now, what can lead to this imbalance of the bacteria? Stress is one thing that can cause it. The kind of foods that we eat, usage of antibiotics, lack of rest, lack of exercise, these things can actually cause it, and it may even exist from childhood. So you may find that the person may have this condition, in terms of the imbalance going on for a very long time, and then the condition may develop during that time or later. Now, so what you find also is that the influence of the bacteria and the brain, they go both ways. We find that if any stress is happening in the brain, it can affect the bacteria, and of course if there's an imbalance in the bacteria, then it can affect the brain function. So the influence actually goes both ways. Now, this information can be very useful in treating this condition. You can actually influence the balance of the bacteria in the intestines. There are several ways in which this can be done: by making changes to your diet, ensuring that you get proper rest, and by giving probiotics. Probiotics are certain foods and supplements which can improve the balance of the bacteria in the intestines, and it has been shown to help in the treatment of anxiety disorder. And as I mentioned before, exercise and getting enough rest, and also by giving what we call prebiotics. Now, prebiotics are specific nutrients that have been shown to give nourishment to the bacteria in the intestines, and these have actually been shown to improve on the situation as well. Of course, there exist the traditional treatments. You have medications, and you also have psychotherapy, and these can also help in the treatment of these conditions. So, in summary, anxiety disorder is a medical illness, and it must be assessed and managed by a medical practitioner. It can be helped using certain supplements and certain medications, and also other interventions that have been shown to be quite useful, and they can actually help to control this condition very well. Thank you very much, and see you again soon.